Hi everyone, this is Dr. Stefan. Welcome to another video. In this one, I'd like to answer a question about what is a COPD flare-up versus just having a chest infection or a viral infection or a cold or things like that. So this is, again, one of these interesting questions that pops up on the channel. Some of these questions may seem very simple, but actually a lot of people kind of worry about the nuances. So a COPD flare-up or an exacerbation just means that it requires a change in treatment. So this is the distinction basically. So what you are experiencing is maybe you're having a chest infection, you're having a cold, you've been exposed maybe to some toxic fumes or something like that, and you become more breathless, and that requires additional treatment on top of your routine COPD treatment. So that would be the minimal definition of an exacerbation of COPD or a flare-up. Whereas if you're getting a cold or a virus, a little infection, something like that, it generally doesn't always require that you increase your therapy. So for instance, you may not need additional corticosteroids or antibiotics to get past that cold. Let's say maybe you're a little bit older and you have your niece and nephew visiting and they have a bit of a cold they've picked up in kindergarten or something like that, and you pick up a bit of a virus. Maybe you need to use your inhalers a little bit more, but you don't actually end up needing therapy to prevent you from going into hospital or things like that. So that would be basically the definition between a full-blown flare-up or exacerbation of COPD and just getting a little bit of a virus, a cold, where you may feel a bit unwell, you may have a runny nose, maybe your muscles ache a little bit, you feel a bit fluey, as they say, but nothing else much changes in your routine COPD treatment. Your chest doesn't go very tight because of that. Whereas in an exacerbation, it can go very tight, and sometimes people require quite intensive therapies. Sometimes they may require one lot of antibiotics that may be given by the family doctor or the general practitioner, or maybe you have a rescue pack of antibiotics at home and you take these and maybe you're still not recovered. Maybe you require to take a short course of corticosteroid treatment, which is an anti-inflammatory treatment with maybe prednisolone, and you take this for maybe 5 to 7 days, maybe alongside the antibiotics. Sometimes people cannot get past one of these flare-ups just in that way. So sometimes they may require actually a second type of antibiotic because maybe they're still coughing up a lot of green phlegm. They're still more breathless. There's more sputum being produced. You require more inhalers, you require these therapies. And then if you're failing lines and lines of this treatment and maybe you require oxygen more so than usual, you are in a clinical situation where things are going the wrong way, sometimes it is actually needed that you go to the emergency department of a local hospital. You maybe are admitted for a little bit for nebulizers, for more invasive therapies, maybe intravenous antibiotics. Maybe there is a need for further and further lines of therapy. And the COPD exacerbations or flare-ups are not something that we should take lightly, because if people have maybe more than one or two every year, it is a high-risk situation. And this is according to the guidelines, because the more exacerbations you have, the less time you have between them to actually let your airways recover, let that inflammation that's been exacerbated during that flare-up settle down. So you need more and more time to recover. So if you're moving from one exacerbation to the next, it can make you really, really breathless. You don't have time to recover. You don't have time to kind of get your muscle strength back, because sometimes when people are dealing with one of these flare-ups, they may be quite flat. They're not able to maybe leave the house. They cannot do a lot of things, and you can lose a lot of muscle mass. You can become very deconditioned during these situations. Other complications can occur, maybe related to cardiac disease or other things that are there associated with the COPD. So reducing the risk of exacerbation actually prevents long-term decline and prevents the progression of the condition. So I think if you are dealing with a lot of these flare-ups, if you're having to take antibiotics and steroids very often, I would say that it's really important to maybe consult with your doctor and see whether anything else could be done, whether there needs to be a change in your routine treatments. Maybe you need to be on a prophylactic antibiotic, so something that actually prevents these flare-ups from occurring. So this could be maybe something like azithromycin or some other antibiotic that is given more regularly, sometimes not every day, but maybe every other day, maybe 3 days a week. There are different options. I don't want to recommend any specific antibiotic that you should take. You should just consult with your doctor and see which one might work in your situation. Every person is different. Always go and check with your doctor. Anything that you hear me saying or anyone else, please always check, because your situation is very particular. You have maybe tailored therapies that you require. That being said, just be mindful that COPD flare-ups can be dangerous. It's important that if you're getting a lot of them, you need to try and see if there's a way to prevent them. Just having a cold or a virus doesn't always mean that you need to have additional treatment. So sometimes you need to see how things go. If you are becoming, though, more breathless, you are really, really struggling, you may then require the extra treatment. So that may be a full-blown exacerbation or a flare-up. But sometimes the distinction can be difficult, and sometimes people have a very low baseline with COPD. This is just another thing that I wanted to add out there. I keep remembering things because these are the things we sometimes discuss with patients in clinic. So you may start off, for instance, with a very low baseline. So if you are really, really breathless, you have a lot of symptoms because of COPD. It may be that even when you get a small virus, you feel extremely, extremely breathless and you're finding it really hard to cope. And in those situations, even though maybe that virus would go away in a couple of days, a lot of people do end up taking extra therapies. So it kind of blurs the line a little bit between just a virus and the full-blown exacerbations. And sometimes people end up taking a lot of corticosteroids, a lot of prednisolone courses back-to-back, sometimes with very limited gap between them, maybe only a few weeks or a month between each course. And there is a risk of developing all kinds of other complications when people are taking steroids regularly at high doses to try to, as if they're treating exacerbation. So I think if you are getting a lot of these situations where you require rescue packs of antibiotics and steroids, you're taking these at home maybe, if you've had maybe a couple of these in close succession, probably it's a good idea to discuss with your doctor. Maybe you need to be referred to a pulmonologist, a respiratory physician, try to discuss the situation, see if you actually need the steroids, see if there's another way to try to prevent these exacerbations, because those cumulative doses of steroids can also make your immune system a little bit weaker. So you are at a higher chance of getting all kinds of other infections. So you can very easily, as you can see with COPD, move into a situation where you're in a vicious circle. You're in a vicious circle where you're getting the flare-up, you take treatments, that may reduce your immune response, you get another infection, and so on and so on. That can lead to more complications related to your heart. Maybe sometimes people develop diabetes, they develop muscle weakness, so because of the excessive amount of steroid that has been given. So a lot of things can actually happen in these situations. So it's important to try to keep the COPD on a tight leash, if we can do that. So if you are really, really struggling, please consult a doctor as soon as you can. Try to make sure that you have a long-term plan to manage your condition. Try to see if there's a need to go for pulmonary rehabilitation, to be a little bit more active, to try to have better balance, to try to have better strength in your respiratory muscles, to be able to cope with those situations when you do get a virus, because all of us will catch a virus at some point. We can only do so much to prevent them. We can get vaccinated, we can stay away from people who are ill, but at the end of the day, we all catch a cold maybe at least once or twice a year. So especially if for someone who has a chronic lung disease, if you get that on top of the lung disease and you're struggling to cope with the lung disease as it is, you can imagine it will be very, very hard to cope with that very minor cold. And you might see it as an exacerbation. So if you need the treatment for the exacerbation, by all means, you will require that. That can be guided by, your doctor or someone else who's seeing you, maybe in the hospital. But it's important to know that these can happen. So it's important to try to keep on top of the COPD as much as possible, and always thinking about what is happening long term. Where might you be in the next few years? It's important to try to think a bit long term. What's the plan for the treatment of your condition? What are some other things that you might be able to consider? And I do encourage you to always discuss these things with your doctor to have a clear idea of where your condition is going and whether there's a need for anything else to be addressed. Hopefully this was helpful. If you have further questions, do leave them in the comment section below, and I'll see you in future videos. All the best and good health.